Hello, I am Dr. Srisailesh Vitthala, one of the fertility specialists in the city. Today I am going to talk about polycystic ovarian syndrome. What is polycystic ovarian syndrome? Polycystic ovarian syndrome, in short called as PCOS, is very common. Here I must insist, PCOS is not a disease, but it is a condition where women can have irregular periods, women can have facial hair, oily skin, acne, and women in the reproductive age group find difficult to get pregnant. Like I said, PCOS is very common. What I mean by this is 1 in 4 women in a reproductive age group can have PCOS. It is manifested as with irregular menstrual periods, obesity, facial hair, sometimes insulin resistance, and also infertile. What causes PCOS? In women, usually every month they release one egg. The release of egg in women every month is called ovulation. In women with PCOS, unfortunately, many of them do not release an egg. They form very small follicles but does not lead to ovulation due to hormonal imbalance. This is called anovulation, and this is the main cause of the PCOS. Diagnosis of PCOS is based on 3 parameters, not on single parameters. The 3 parameters are: number 1, clinical features, which may where irregular menstrual periods; 2, biochemical, where hormonal imbalance can be checked; 3, ultrasound, where polycystic ovaries can be visualized. Now, 2 out of these 3 criteria which I have mentioned are there, then we label or diagnose women with PCOS. I must emphasize here that PCOS is a dynamic condition, which means in some months there could be PCOS and some months there cannot be PCOS based on the criteria which I have mentioned. Again, I repeat, 2 out of the 3 criteria which I mentioned above is needed to diagnose women with PCOS. What are the symptoms of PCOS? Women with the following symptoms can be labeled as PCOS. Women who has a less number of periods, I mean less than 8 in a year. They gain weight or they can go into obese. They can have some facial hair in the upper lip, chin, sideburns, chest, thighs, which might mimic similar to the men. Women finding it difficult to get pregnant. All these above symptoms can be leading towards the PCOS. What are the tests done to diagnose PCOS? Common tests done to diagnose PCOS are 2. 1, blood test; 2, ultrasound. In blood test, doctors evaluate or measure the hormonal imbalance. They are FSH, LH, E2, testosterone, cholesterol, and blood sugars. 2, ultrasound. In the ultrasound, they try to look small number of follicles, usually more than 15, 12 to 15 I would say, on both ovaries are indicative of PCOS. What is the treatment for PCOS? The treatment of PCOS depends upon what exactly the woman wants. For example, if woman wants her periods to be regularized, the common thing they regularize women's period is by using the birth control pill. The birth control pill not necessarily treat the cause, but however it could definitely make her periods regular. Other part is taking a progesterone tablets, maybe 5 to 10 days every month, so that she will have a regular periods. If the woman wants her facial hair to be treated, then the facial hair should be treated in 2 ways. 1, non-medical, that means using laser, ablation, or using the lotions on the face to prevent further hair growth. Or 2, taking medications which we call anti-androgens like spirulolactone, etc., to prevent any facial hair to grow. If woman wants to conceive, then it is totally a different treatment. The medications which they take for getting pregnant is called ovulation induction drugs, and it has to be followed by scanning to see if they are making eggs. Irrespective of any treatment, if the women are obese, they have to change their lifestyle. I mean, change in their diet, lose weight by doing exercise or yoga or anything which helps to bring her weight down. Many doctors can also use anti-diabetic or diabetic medications called metformin to help to any of the above features. What are the long-term problems of PCOS? The PCOS women have a long-term risk of developing diabetes, 2, high cholesterol, 3 cardiovascular disease, and if they don't have a regular periods or if they don't conceive, they might have a small risk of developing uterine cancer. Of course, getting pregnancy is also a difficulty. So it is very important women with PCOS to seek doctor's advice to address all the issues.